You're watching the Fox 5 Morning News at 7.
Live look from our SDCCU.com camera. It's chilly outside. I know it looks like it's 80. It's not 80. It's cold. It's cold, but no rain right now. 7:43 if you're just waking up. A new CDC report shows that working in an office may double your risk of getting COVID-19. Dr. Richard Chaffoo explaining this new study. Double,
Shally. Yeah, it's interesting. This just came out from a report published Thursday by the CDC's Prevention M&M weekly report. And the study was interesting because it showed, Shally, that those workers who regularly went to work or commuted to work were actually twice as likely to test positive for COVID-19 than those who primarily did teleworking. And this obviously shows, at least with this smaller study, early study, that people that regularly work in a workplace and don't work from home or don't telework are twice as likely to get the coronavirus.
So what do we learn from this? As many people, I mean, a lot of people went back to the office. Looks like we might move to the purple tier. We might be coming back out of the office right now. But what is the takeaway? What do we learn?
So I think, Shally, what we're learning is that, probably I think many people, when they're in a work environment, a place where they're very comfortable and they're around other cultures, maybe we let our defenses down. Maybe we're not doing the social distancing. Maybe we're not wearing the mask. Maybe we're not, avoiding, crowding around, say the coffee pot or the break room. And certainly we know that those are factors that are directly associated with this increase in the incidence of this virus, especially during this time of the year.
I've often wondered that, Dr. Chaffoo, almost every morning when we report the new numbers that came out. Usually one of the last lines that we say is that there was a community outbreak at a business, et cetera, et cetera. And in those moments, I wonder, well, what is happening in that business? I wish we would know. Are these businesses that have the mask on and they're social distancing and they're following the guidelines and somehow they're still getting COVID-19, or are these businesses, which I've walked into a few, and nobody's wearing a mask? It's not even as if we're in a pandemic. So are those the businesses getting it, or the ones that are?
I think it's the latter, and I think you hit the nail directly on the head, Shally. It's probably the fact that we've sort of gotten used to this virus being around. Maybe early on people had their guards up. They had a more heightened sense of concern, and they were listening more to public health officials, really, which should be really driving this debate and driving this message for all of us. And since this has gone on for a longer period of time, people become somewhat complacent, and they're letting their guards down. But certainly, as you made a good point, in the workplace, it is the responsibility of employers, as well, of course, employees, that we all work together to bring an end to this pandemic as we're all waiting for a vaccine. And those are simple things, the mask, the hand washing, the social distancing. And, if you're in a work environment where there are a lot of cubicles that are quite close together, the idea of putting up some sort of dividers, as I've seen some restaurants and other places, would be helpful to reduce the spread of it.
As you bring this up, it makes me think about what we reported a few days ago about Trader Joe's. And looking it up, Trader Joe's said that it had 1,250 reported COVID cases among their 53,000 staff members. I'm wondering, businesses like this, which I've seen with my own eyes, Trader Joe's is just everybody's masked up, and it seems like how is the virus then getting to 1,200 people if everybody's doing what they're supposed to be doing?
Well, because remember, that's 8 hours a day, and employers only have we can only control so many factors, and people are people. So maybe when they go out of work, they're going out, to a bar, or they're mixing with friends, or they're again letting their guard down. We need to remember that when they're in a work environment such as Trader Joe's, which I've shopped at, and I couldn't agree more, and many other businesses are very, sensitive to the pandemic, and they have a control over what happens in that workspace.
Yes.
It's when those people go out past that obviously the issue is coming about. You're not going. The take-home message is you're just probably not going to get this virus if you wear a mask and if you social distance and if you wash your hands and you stay away from large gatherings. It is a respiratory virus for the most part, and so those simple things are going to really keep all of us safe.
Dr. Chaffoo, I mean, honestly, as I say thank you, the one thing that I have learned from the doctors and scientists and everyone that I've interviewed over the past 8 months, it's that, and it's when we are around our family, when we are around our friends, that's when we feel comfortable to all of a sudden take that mask off. And this is where the problem, that these doctors and science, I'm not a doctor scientist, I don't know, I just report what you guys say.
But you're right, because we're very social creatures, and this is what's engineered in our DNA. So it's very difficult. People that we're familiar and around, but as you say, the mask is not just protecting me, but it's protecting you, and it's protecting our community in general. So it's easy to let our guard down, but in this time right now, it's really prudent to follow those guidelines that Dr. Fauci and Dr. Birx and those other scientists have really helped to lead us through this. And hopefully we'll be on the other side soon once we have a vaccine, and then we'll be able to put this behind us. But right now we're in the throes of it. We're in the winter season. The flu season is coming. People absolutely need to get their flu vaccine as well. This is urgent for anyone at this point. We don't want to get the flu and the COVID on top of that.
No, we don't. I don't even remember the name for double the infection. Dr. Chaffoo, there's a name for it. Twindemic.
Serious.
Yeah, serious. There you go. Thank you, Dr. Chaffoo. Still to come.
Thanks, Shally.